Hi, my name is Dr. Kurt Hayes. I'm the oral surgeon at Cold Creek Oral Surgery in Lafayette, Colorado. I did my undergraduate education at the United States Air Force Academy down in Colorado Springs. I then was sent to the University of Colorado School of Dental Medicine in Denver. And from there, I proceeded to go into the Air Force for 13 years, doing my residency down in San Antonio at Wilford Hall Medical Center. I became an oral surgeon because when I was in dental school, I saw the impact that oral surgeons made on other people's lives. Basic things like getting people out of pain from wisdom teeth or infected teeth, restoring smiles with implants, or all the way up through craniofacial surgery, changing people's jaws and affecting how they saw themselves and how they went at life. When a patient comes in for evaluation for teeth in a day, it can be an exciting and scary experience all at once. We really try to sit down and evaluate why you wanted to come in and see what are the motivations behind getting this treatment done. This could be a life-altering procedure for you. And we understand that there are several hesitations that come into it, whether it's how you're going to look, what the transitions are going to be through the different phases of treatment, or even the financial aspect. We're here to treat you and to help you through this process. My favorite part about helping people with teeth in a day and restoring their smiles is that moment when they get to look in the mirror for the first time, realizing that the vast majority of problems they have dealt with for years and years, whether it's been pain, infection, or anything else, has been taken care of, and the replacement is there for a good long-term solution that gives them the ability to chew, to eat, and to smile again. If you're interested in teeth in a day, but you have reservations regarding the surgery or the pricing, please come see us. I want to explain everything that goes on from the evaluation appointment through the surgery time, and even discuss the financial options with you. The surgery itself is done under general anesthesia, and so you don't remember the vast majority of what goes on during that time. You go to sleep, you wake up, and the surgery is completed, and you have a brand new smile. As far as the financials, we have so many options that can get you to a spot where you can afford this surgery. We understand that it is a difficult decision to make, and there is obligations that go along with it, but we want to be there to help you through those processes. The surgery itself, while daunting on the day, can be a very manageable and pleasant experience. We do use a medicine called Exparel that leaves you more numb through the surgical sites for about 36 to 72 hours. The vast majority of our patients do not need any narcotics for this procedure, meaning that while you just had surgery and are a little swollen and sore, you are not in a significant amount of pain. And you're also in a much better place physically and mentally, as we are getting you to a spot where you are good for the long term instead of being in pain or discomfort.